in eyeglass lenses and or contacts. I've dealt with many questions about blue light. I am not somebody who believes that all blue light is terrible. I think it's important to avoid bright lights of any wavelength late at night if you want your melatonin production to be normal and you want to sleep well. It doesn't matter if you're wearing blue blockers or not. If you're just under blastingly bright lights, it's going to suppress your melatonin. And yet some people enjoy blue blockers for that reason. Nowadays, a lot of people wear blue blocker glasses or blue blocking lenses or contacts throughout the entire day, thinking that blue light is bad for our eyes during the day. I happen to subscribe to the idea that we want as much bright light as we safely can tolerate during the day, ideally from sunlight, in order to set our circadian rhythm. And yet a lot of eyeglasses and a lot of contact lenses out there have UVA and or UVB blocking features to them. So what are your thoughts on this? And I'm perfectly happy to be wrong and revise my stance on this. What do you think about this UVAB blocking?
Yeah, it's really important to distinguish that UV light on the light spectrum is right next to blue light. Red light's on the other end, and of course, infrared is beyond that. And our eyes, other animals can see these, but our eyes can't see infrared. That's why we call it beyond red. And we can't see ultraviolet. We call it beyond violet. UV light is right next to blue light. UV light is known to have a lot of adverse effects. It's not really good for our skin, and therefore, we really want to avoid sunburn and kind of UV, exposure and damage on our skin. Similarly, it's not really good on our eyes, and it affects both the ocular surface a little bit in terms of like kind of how dry or irritable your eyes might feel for some people. And certainly over the long term, UV light will accelerate the formation of cataract, which is a blurring of an oxidative blurring of the lens inside the eye. Profound UV light can be damaging to the retina if you're getting way too much on the inside. So blocking UV light, I believe, is just absolutely standard in every pair of eyeglasses. And I don't know actually to what degree the different kinds of contact lenses also filter at least UV light. Now, blue blocking glasses is totally different. And as I say, I think almost all glasses, because almost all glasses are not made of glass anymore. They're made of plastics. But I think almost all of them now filter the UV light, which again is probably the safe move for our eyes and periocular environment, around the eye environment. So blue blockers, that's been a huge fad. And I'll tell you, the last 3 years through the pandemic, everybody getting on their computer, hours in front of Zoom meetings where we used to walk from building to building for a meeting, things like that. I remember, this sort of big uptick in these kinds of questions. And I'm not sure that there's any data that blocking blue is helpful in any way. And as you say, it may actually play into sort of circadian entrainment of our natural daily rhythm. So I think blocking UV is a good idea, and I think it's pretty standard. They make glasses, by the way, that actually react to UV light. They're called transitions. There may be a few different brands, I don't know. But these are the sunglasses that are clear, except then they turn dark if you're out in the sunlight. And it's not just any sunlight. It's actually the UV wavelengths that cause the chemical reaction in the glasses to turn from clear see-through to sunglass blocked glasses. And you may notice, if any of you out there are using these kinds of glasses, that they don't work in the car. You'll wear them in the car and they won't go to sunglasses even though it's sunny out. And again, that's because all standard car glass also filters UV. That's why if you're riding around in the car and it's sunny out and you've got your hand, up next to the window wearing a t-shirt, you never get a sunburn through the car window anymore because all our car glass is also filtering UV light for us. So
that's a very informative answer. And before we started recording, you and I were discussing this practice of morning sunlight viewing, which again, I highly recommend over and over. And you pointed out that low solar angle sunlight, so sunlight low in the sky, viewed for maybe 10 minutes a morning. And again, not forcing oneself to look at it and stare, but blinking as needed, is not going to cause extensive UV damage to the eyes. It's really when the sun is directly overhead that we're getting a lot of UV, which raises this other question, which is for people that don't wear corrective lenses and therefore are not blocking UV light to the eyes, what should they do? Are they in trouble? Should they be wearing a brimmed hat?
Brimmed hat's a great idea. That'll get rid of a lot of the direct light into the eye. Of course, you still have reflected light off of surfaces, and that can include UV light, of course. Wearing sunglasses outside, even if you don't have corrective lenses, it may also be more comfortable to wear sunglasses outside. So these are all fine. At the end of the day, it's probably not making a huge difference in the health of your eye, whether you've spent the last 50 years wearing sunglasses really dogmatically for your outdoor time or not. If you were going to develop, let's just say, age-related cataracts inside your eyes, which we'll all get, if we all live to 120, we all get cataracts. It's going to happen. Some people younger, some people older. Maybe if you were really dogmatic about wearing your UV blocking sunglasses, maybe you'd get your cataracts at 75 years old instead of 72 years old. It may not be a huge difference in that regard. So again, not something to be super stressed. I think it's more a question of just what are you comfortable in, and then certainly I will say the other advantage of a wide brim hat is it's keeping sun off of your face. And these are especially the upturned portions of your face, like the cheeks and the nose. These are some of the most common places to get some of the skin cancers that you can get over a lifetime of sunlight exposure. The wide brim hat it's helping you for that as well.
Mm-hmm. Can't help but ask about comfort at varying levels of brightness. I'm the person that when sitting in a cafe or something and on a bright day, I can be directly across from somebody like you who seems to be perfectly fine without sunglasses and maybe even we're shaded under an umbrella or something of that sort, and I'm squinting like crazy. Is it normal for there to be a pretty wide variation in sensitivity to light? And does this have anything to do with the lightness or darkness of the eyes? You have brown eyes, I have green eyes, but is there any real correlation there?
Yeah. It's a good question. I don't know if it's been formally studied, but I will tell you, I have the same impression you do, which is that if you have blue eyes or light-colored eyes, that you're more likely to have more sensitivity. We know that there's differences in the iris muscles that constrict and dilate in response to light. For example, when you go into your eye care provider and they're going to do a dilated exam and they put the eye drops in your eye that dilate the eyes, they sort of change the nerve impulses onto the iris muscles so that the iris dilates and you get those big open eyes. People with blue eyes, we absolutely know, blue or hazel or light-colored eyes, you put that eye drop to dilate their eyes, it's going to last 4, 6, 8 hours, whereas in a brown-eyed person, often the dilation only lasts 1, 2, 4 hours. So there's clearly biological differences between the irises and their muscles and maybe the nerves that feed those muscles. Between light-eyed people and darker-eyed people. And that may also, therefore, relate to this differential sensitivity that some people have. If you're not able to constrict your eyes in the bright light as effectively, you're going to find that bright light more frustrating, more annoying, even painful. People will feel like their eyes are cramping almost as they try to get those eye muscles to activate to bring down the pupil and block some of that excess light from getting in.
Interesting.
Yeah.
Let's go back to LASIK. What is LASIK, and should I get LASIK eye surgery? Yeah. Does everyone need LASIK? Can it help can it make us, super physiological? Can it make me a 2010?
Often it can. I'll just say that, right up front. It is amazing. People will come out of LASIK surgery better than 2020. But the cornea, we talked about before, that's the clear window on the front of your eye. All the light has to get through there. And we talked about before already, if your cornea is misshapen, if the basketball shape of it is too shallow or too steep, then you're going to need glasses to see at distance and also at near. If it's too football instead of basketball, then it's going to be what we call astigmatism, and then you need a correction for that. Instead of correcting with glasses that sort of help shape the light so it can go through your slightly off-shaped cornea, instead of wearing contact lenses, which also shape the light just as it's entering your cornea, right on the surface of the eye, you can just reshape the cornea. And the way LASIK does that, there's a few different versions of LASIK, but basically the way the LASIK does that is it actually ablates or gets rid of a little ring or rim of that corneal tissue. So that, for example, if you were a little shallow and you got rid of a little bit of that tissue around the edge with the laser, LASIK, starts with the word laser. If you got rid of that edge tissue, then you're sort of making it a little more basketball shaped, right? Or if you were too steep on your cornea and you use the laser to kind of shave off a little bit of the tip of that basketball, right? Then you're flattening out the cornea. So it's that kind of reshaping. And the technology has come so far that the LASIK procedures can actually correct not just the regular aberrations that we talked about, but also some of these higher order aberrations. And there are different monikers for this kind of LASIK. It's all, I think, become fairly standard, but wavefront guided, where it's actually using light waves to measure with a very exact localization exactly how much and where to laser for each individual eye to make that cornea pass the light as ideally as possible. Now, 1 or a few % of patients will actually have a dry eye problem. So after LASIK, because it does interfere a little bit with those corneal nerves, for example. And I do think that if you're a person who already has dry eye, hopefully if you're asking your eye surgeon about LASIK, hopefully you're being counseled that if you have dry eye, this might not be a good idea for you. Just like contacts might not be a good idea for you if you already have a lot of dry eye. But for a lot of people, especially a lot of younger people, it's quite common. I think the statistics suggest maybe 15 or 20% of people who would benefit from LASIK, who would otherwise be wearing glasses may get LASIK at some point in their life. And I used to joke, LASIK, it costs more money than a pair of glasses, but it doesn't cost more money than 10 pairs of prescription glasses over the course of a decade or two, And so I used to joke that, gosh, if everyone had to have laser eye surgery for their best vision, and someone came along and said, hey, I've got an invention. You don't have to have laser eye surgery anymore. It rests on the ears and the bridge of your nose. I call them glasses. Could they have sold those for $1,000, $2,000 a pair? I don't know, maybe. But, there's kind of a cultural element of saying, I don't want to wear glasses. I'd love to be able to walk around without relying on glasses or contacts. Of course, people who are very athletic or spending a lot of their time doing athletics, they may be quite irritated to have to deal with glasses or contacts. People who have very severe prescriptions. I mean, if you wake up and you can't even really, you're fumbling for your glasses on the bedside table because you have such a strong prescription, you can't even see what it says on the alarm clock next to the bed. These are all groups of patients who really change their daily lives by getting out of glasses or contacts and taking advantage of LASIK. And in, 99% of the time, it's going to be a safe, comfortable outcome for the patient.
Do they do LASIK on kids?
There are certain conditions, unusual corneal conditions, where procedures like LASIK get used, but I believe it's ideal to not do it on children or even young teenagers. And the reason goes back to what we were talking about before. You are much more likely to change the shape of your eye, and therefore the prescription you need, and therefore what exactly the LASIK would laser while you're still in those growing years. And you really want to be able to say, hey, my eyeglasses prescription has not changed in the last 2 or 3 or 5 years. Because if you do LASIK and then your eye keeps changing shape, then by the next year, all of a sudden the LASIK's not doing, you're back in glasses again, right? You can do a touch-up LASIK, do a little bit more, but it's generally, you're going to be a happier person if you've reached that point in your life, and maybe that's your late teens. More commonly, it's into the 20s, where your eye has stopped changing its prescription every year, you've been steady and stable for some years, and now you do the LASIK and it could easily last you a decade.
You mentioned dry eye. Get a lot of questions about dry eye. And a few years ago, I think you and I were at a meeting, and someone who is very woven in with the companies that build and test drugs for different aspects of vision health said, you know what the field really needs is a treatment that works for dry eye. And I thought, dry eye, like of all things, like why dry eye? And then the more I learned about it, I realized that there are millions and millions of people that really suffer from dry eye and for whom standard drops are just not working. So what underlies dry eye? Is it some deficiency in the lacrimal glands that produce tears for the eye? And I think of tears as just kind of salty water. And I wonder if they are more than that. Is there an oil in there? And if we know what's in tears, why can't somebody just manufacture something that works as well as tears?
Yeah. It turns out, we've got a lot of other eye diseases, but by far the most common eye disease, and I've been told by far the most common eye treatment, purchased by anyone. Now, granted, it's almost always over the counter, things like artificial tears, is for dry eye. And in part, that's because as we age, our tear quantity goes down and our tear quality goes down. And so what do those two mean? We have two different